Oh, it feels like a storm's a-coming. I'm sure you guys have heard that joke before. Weather starts to change, you can feel it in your joints. It's kind of a real thing. There's not a lot of research on it, to be honest, as far as anything that supports it. But as a clinician who's been seeing patients for the last 15 years, I'll tell you that there's definitely something to be said for the change in symptoms in the presence of changing barometric pressure. If you're not sure what barometric pressure is, it is the pressure of the atmosphere as different storm systems either move in or move out. And there's a baseline. Anytime we move from that, so whether we go from high to low pressure or low to high pressure, it's a change. Think about this. Our bodies are essentially a pressure sensitive system. So I push on my skin, I feel it. That's pressure. Every single joint that I have, and even inside things like my head, my eyeballs. So again, all the joints are all closed system. There's fluid in there. So when you change pressure, you are going to get something. You're going to get something's going to feel different. So as we are changing pressure, that change in pressure that's perceived by our skin, our closed systems like our head and our joints, can sometimes register a signal which comes across as pain. Also, if we think about it like when you get injured, you get swelling. And again, if we think, superficially like, oh, I got a bruise here, it's gonna swell out, that's one thing. I'm sure you guys have all pinched a nerve in your neck where you pinch something in your neck, probably that facet joint, and then you go to turn and it just won't go because that joint is totally distended and inflamed and irritated. That's pressure inside that is the same thing. So if I have an injury where there is some swelling involved, so let's say maybe I had shoulder surgery, maybe a knee, maybe I have a back injury like a disc or neck injury like a disc, and there is a change in weather, you can totally feel that. And it is totally valid and validated that you can feel something and it's okay. Some of our patients who, not right now because it's COVID, but when they would travel and have to get on an airplane, it's like, yes, the cabin's pressurized, but there's still a massive pressure change. And that a lot of times is perceived by the body as pain. So, oh, I had a total increase in symptoms, even though it was a short flight or something like that. It's like, yeah, that's a real thing. So again, the whole point of this Monday Musing is just to kind of talk about the body being pressure sensitive. There are environmental factors to that, including weather, including travel, which hopefully we can do one day soon, that can definitely influence your symptoms. It's usually a very transient change. It doesn't mean you're going to feel it forever, hopefully, but it might be something that your body is picking up on. To piggyback on that, one of the concepts that I really liked was sometimes when your body doesn't know what to do with the signal, because again, we've talked about this before, pain is just pressure onto something, it turns it into a signal, and our brain has to interpret that signal. And sometimes when it doesn't really know what something is, you get a pain signal. Or when there's not a very clear picture of what that signal is supposed to be coming in, it kind of registers as pain. It just goes that way sometimes. So if you feel something with the incoming weather or changing weather, we've had these storms lately, don't think too much about it. Try not to worry about anything unless it doesn't go away in 5 to 7 days. Then we can have a talk and see why isn't it going away. So again, if you're the local predictor of storms, that's okay. You can just be the local meteorologist.